The honourable member for Cape Breton Centre.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister responsible for seniors. We have heard from families and community organizations about the need for more nursing home beds. Families are concerned that their loved ones are being kept in hospitals instead of receiving proper long-term care. More than 20% of all hospital beds were occupied by alternative level of care patients in 2018. Mr. Speaker, I'd like to ask the Minister, is forcing seniors to stay in hospital beds because there are no long-term care beds available a responsible approach for providing care for seniors?
The honourable minister responsible for the Seniors Secretariat.
Thank you, Mr. Speaker. I thank the member for the question. We know that seniors' issues and a wide range of them with programs are the purview of the Department of Seniors, and we have a number of programs around age-friendly communities and ways in which we do support seniors through our work. We just this week celebrated the GovLab, which again is coming up with new and innovative ways of supporting seniors in our communities and staying safely in their homes as long as possible.
The honourable member for Cape Breton Centre.
Thank you, Mr. Speaker. Mr. Speaker, when seniors are forced to stay in hospital beds instead of being placed in long-term care, they do not have the same quality of life that they would if they were in a proper nursing home. There's no recreation or programming opportunities in hospitals. There are limited opportunities for social interaction. Living in a hospital bed is not good for anyone in the long term, and I've had the experience, Mr. Speaker, to chat with people who are living in hospital beds and are missing out on the social interaction that's provided in long-term care facilities once that is where they need to go. The average total length of stay in a Nova Scotia hospital for an ALC patient is more than 100 days. This is unacceptable, Mr. Speaker. Mr. Speaker, what is the minister doing to get seniors out of hospital beds and into proper long-term care facilities?
The honourable minister for Seniors.
Thank you very much, Mr. Speaker, and that is one of the challenges that has faced all governments for the last couple of decades. What I do know is that the list for seniors in hospitals has been dramatically cut. I remember the days when there would be 30 patients at Valley Regional. Now it's down to about 10. But what I could really tell the member opposite is that if I were in Cape Breton, I'd be celebrating the new long-term care beds coming to Cape Breton.